Today, let's talk about heart failure pharmacological treatments and outcomes in heart failure with mildly reduced ejection fraction. Guideline recommendations for the treatment of heart failure with mildly reduced ejection fraction derive from small subgroups in post-hoc analysis of randomized trial. The objective of the study was to investigate predictors of renin-angiotensin system inhibitors or angiotensin receptor neprilysin inhibitors and beta blocker use and the associations between these medications and mortality or morbidity in a large real world cohort with heart failure with mildly reduced ejection fraction. Coming to the methods and results, patients with HFmrEF from the Swedish HF Registry were included. The associations between medications and cardiovascular mortality or heart failure hospitalization and all-cause mortality were assessed through Cox regression in a 1:1 propensity score matched cohort. A positive control analysis was performed in patients with EF less than 40%, while a negative control outcome analysis had cancer-related hospitalization as endpoint. Of 12,421 patients with HFmrEF, 84% receives ARNI and 88% beta blockers. Shared independent predictors of renin-angiotensin system inhibitors and beta blocker use were younger age, being an outpatient, follow-up in specialty care, and hypertension. In the matched cohorts, use of both ARNI and beta blocker use was separately associated with lower risk of cardiovascular mortality or HF hospitalization and all-cause mortality. Results were consistent at the positive control analysis, and there were no association between treatment use and the negative control outcome. To conclude, renin-angiotensin system inhibitors or angiotensin receptor neprilysin inhibitors and beta blockers were extensively used in this large real-world cohort with heart failure with mildly reduced ejection fraction. Their use was safe since associated with lower mortality and morbidity. The findings confirm the real-world evidence from previous post-hoc analysis of trials and represent a further call for implementing guideline recommendations.